Carol's our medical devices coordinator, and her role is to really get out there and engage with the nurses and all our clinical users of medical equipment, and to make sure they've got the right equipment at the right time.
Carol is an ambassador for patient safety. She only has to get wind of any issues to do with patient safety, and she's on the case. Carol was one of the originators of the incident investigation group. Because we investigate all the patient safety instances and the technical instances, we can start trending issues and then going back to the departments and giving feedback and hopefully prevent similar sort of occurrences.
Well, Carol's very hands-on when you have problems with equipment. She gets involved and she's very bubbly and talks to the staff, and able to resolve the issues very quickly.
Patients used to come in and they were seen by the one DVT nurse, obviously, but when she wasn't there, then other people weren't always au fait with how to treat them. So we've started a training programme for all nurses within DVT.
As someone that has recently been trained in DVT, I think it provides a much safer service for patients, because now there is always someone on site or on duty that is able to see a patient, whereas before they may have had to go to another site or may have had to wait.
We take direct GP referrals, and they will get scans if required, same day, and then treatment.
One of the things that we've come to realise over recent years is how many of our patients go home from hospital with really quite profound physical and physiological problems that can persist for many, many years.
You name it, they have it physically. And also psychologically, there are lots of issues with anxiety and depression, through to post-traumatic stress disorders.
Coming to the group meant that they could mix and interact with people who'd been through similar experiences to themselves, hopefully in a fairly relaxed environment where they felt they could chat and openly about what had happened to them.
There's this sort of sense of support that the patients give each other. It's quite magic. They'll sort of shout from one side of the gym to the other about their weird dreams, and they thought they were going mad, actually. They thought they were losing the plot, and actually when they find out that this is going on with somebody else, it is quite healing, I think.
This is about people who've been to ITU, who know exactly what you're talking about. They encourage you to talk about your experiences, and they're able to explain things. This has benefited me so much, it really has. And I feel I can get on with life now.
In every general hospital, there is an awful lot of mental ill health. So in each bay of the hospital, there's going to be at least one person, if not two, with mental health problems.
Unfortunately, there was a very sad incident where a patient came to one of our hospitals and was seen and was referred to liaison psychiatry, and then sadly hung himself in one of our toilets. And we looked into the incident and felt that we had to do something to help the staff manage the patients whilst they were waiting for psychiatry to come. We developed the tool, we then piloted it, tried it, tweaked it a little bit, and then rolled it out and did training across the 3 sites, and now it's in use across the 3 sites.
It actually supports the staff by giving clear instructions of what should happen next.
And it really has gone from strength to strength. I'm really impressed that all of East Kent Hospital staff have taken it forward, have really taken it to be part of their day-to-day work.